You're welcome to my channel. Thanks for visiting. Today, let's examine the differences among these three diseases: common cold, COVID, flu. They are not the same. Without wasting any further time, let's go. From the onset of symptoms, common cold, COVID, and flu are not the same. Common cold, the symptoms will start gradually and keep getting worse as if you are going up the ladder. The same about COVID. Flu, on the other hand, the symptoms will start suddenly. For example, someone who was all well yesterday, today is seriously down. That could be flu. Sneezing? Yes. In common cold? Yes. And it could be troubling. COVID? Not quite, but some may have it. Flu? Well, sometimes, people with flu could sneeze and others may not. Rhinorrhea, yes. In common cold, very well, and could be concerned. In COVID, rhinorrhea, well, some may have it, others won't. In flu, some may have it, others won't. Fever, common cold, it is a possibility, particularly in younger age group. Infants, young children can have fever. And when they do have it, it's going to be mild. So not very common in common cold. Fever and COVID, yes, fever will be present and could be concerning. In flu, fever will be present. Most of flu cases, fever will be there and could be troubling. Nausea, vomiting, diarrhea. Common cold, well, really, they're not so common, is rare, okay? In COVID, some will have nausea, vomiting, and diarrhea, others won't. In flu, some for sure, particularly children, that could come down with abdominal flu. Chills, not so common with common cold, but never say never in medicine, okay? In COVID, some will have chills, others won't, just like as it is in flu. Some will have chills, many will not. Headaches, well, it's possible in common cold, but not so common. In COVID, some will have headache, many won't. In flu, some will have it, some won't. Body aches. In common cold, if at all is present, it's going to be mild. In COVID, most people will have body aches, while others may not. In flu, it is present in majority of anyone with flu. In fact, it could be troubling. Fatigue, not so common in common cold, and if it is present, it's going to be mild. In COVID, this is a serious matter, okay? Particularly long haulers can tell more story about this. It's going to be present and could be so troubling. In flu, it can also come down with fatigue. Cough, in common cold, yes, and the cough here could even be longer than the rest symptoms, just as stuffy nose could also last longer than the rest. So cough and stuffy nose may last as long as 2 weeks. In COVID, cough, yes. And in addition to just having cough, there is a characteristic of cough in COVID that is pretty bad, is dry cough, okay? and it's going to be prolonged. Cough in flu, yes, and it could be trouble. Shortness of breath, in common cold, never say never in medicine. Some may have it, but not so common. In COVID, yes, you can have shortness of breath, and it may be concerning. In flu, it is a possibility, but not so common. Sore throat, in common cold, yes. In fact, almost all the times that anyone who have common cold, they have sore throat at the same time. Sore throat and COVID, some will have it, others won't. Just as sore throat will be present in few people with flu, while others won't have it. Dysgeusia, that is changes in taste, not sensing taste appropriately again, and so on. In common cold, not so common, is rare. In COVID, yes, some will have it, okay? But few people may not have, altered sensation when it comes to taste. And that is a possibility with flu, but rare. Now, diagnosis. All I have said before now, good, educative, or whatever. The best way is to make laboratory diagnosis of COVID and flu, because common cold is clinically diagnosed. But you may rule out the differential diagnosis, including pneumonia, with chest x-ray and some other investigations. But COVID, majority right now all over the world could do rapid antigen, whatever, and then go straight for PCR or nucleic acid amplification test. But don't waste your time with all this. If you are suspecting COVID, as a matter of fact, anything around this now in the world today, just go for PCR. In case of flu, with rapid influenza diagnostic tests, we'll be able to clearly distinguish common cold from flu. And for me to be a silver side, once anything is taking the diagnosis away from common cold, we should rather do PCR for COVID quickly. Then, if it is not, I will then come down to rule out flu. So, with that, I've come to the end of this short presentation. It is easy to go through the clinical signs and symptoms and say, okay, I know it is common cold, I'm guessing it is COVID, it might be flu. The best way to really get the diagnosis to the real definitive diagnosis is this page, these laboratory investigations. Thanks for listening. Please share this with your friends. It might be nothing, but it may be something. It might be nothing like common cold or self-limiting. It might be something serious like COVID. We are familiar with flu. Get your vaccination. Please remember to share this. I appreciate it.